before we do in neck and shoulder, I want to do a short explanation about using the face cradle. So face cradle needs to be kind of stable. Now you can rotate it down. All right. Certain people would be more comfortable with being up and down. It just became relating to the body. So some people would curve, they prefer it a little bit down. So when you're working on the neck, just be sure, come and bring it over here. Yeah. So then the neck is relatively kind of straight, that the face cradle does not shorten their neck, because then it's not going to be kind of very productive. Good. And so we're looking at doing, can you bring the word please? Neck and shoulder. Neck and shoulder. You can start with, if you're starting the neck and shoulder, you can do the hold on this area. So pretty much the same, so I'm going to skip that. And starting with the effleurage. Now, although I do the neck and shoulder, it would be nice to have just few effleurage. Can I do the bro? Can I? I'm going to show you the whole back for short while, and then when you do the neck, very important to have the hair collected. Good. So you can do a few nice effleurage, but really this is not our focus. So when you're practicing now, I want you to practice on what we do next. I don't want you to go back to do the back again. Okay? So a lot of the neck and shoulder are performed from here. The first effleurage I want to show you is called the diamond effleurage, which create kind of a diamond shape around. So I start, warning, it looks easy, but it's kind of a little bit hard. So you take your hands down, you're bringing it up. Around where the shoulder blades are, you bending. It takes back, bring your hands together, and then really takes it all the way up. So again, you can try to do it together with me. It will be, especially if you're a kinesthetic learner, it will be helpful kind of to do that together. So again, there, back, down. Again, down, up towards you, then finger to fingers, heel of the wrist together, and that takes you up. If you want, you can sneak a little one on the head, the arm really, to here, and then bring it up. But try now to kind of sustain it. Don't go too quickly, because this is a very important area. This is where the neck muscle attached to the skull. Yeah? Another effleurage you can do a nice effleurage with side to side. So actually look at my hands. I start with all of the wrist here. When I bend the opposite leg, and then on the neck, I actually use my finger, because the neck is kind of smaller, fragile. Yeah? So later on we'll see that we can take it from the shoulder really. So from the arm. And don't miss the head, very important. Keep it. It's a good exercise also for you. It becomes very strong while you're doing that. Yeah? Good. Another effleurage you can do completely around the shoulder itself. So you go around the shoulder and then go to the side. It's like having two circles. Good. So again, effleurage, warm the skin, relax the client, improve blood circulation. Good. Now, instead of teaching you first the Petrissage technique, let's talk about where you're supposed to stand, because that would determine the technique that you use it. So I'll show you a few positions where you can stand. You can stand onto the opposite shoulder of what you're doing. Yeah? So let's say I'm treating the right shoulder, I will be here. I'm opposite. You can be on the same side, and maybe there would be different technique that you do. And the third position, you can come above. And you can do that either standing, or sometimes kneeling, or sometimes sitting. So before thinking about technique, think about approach, where you can be. So now let's talk about the technique that you can do, Petrissage technique, when you are on the opposite side. Yeah? So you can start by having a finger kneading. So do you all feel this muscle? Can you touch it on yourself? Yeah? Right. This is one of the money muscle. You know what money muscle is? Is that when massage therapists do a lot of money from. So, because the trapezius muscle, and that's a muscle that you feel here, or that's part of the muscle, is quite tight on a lot of people. It's almost like epidemic in our culture, for a reason that we'll see later. So it's nice to be doing really good job around here. So I use the finger tips with two hands, but actually, is my fingers moving or something else moving?
Your body.
I'm moving. Yeah, good. So you get to see that actually the approach of the techniques are the same. Yeah?
Are you coming, when you're doing, are you coming down into the
No,
front a
not
little?
much. No.
Just the top?
Just on the back.
Okay.
Just on the back of it. Good. So you can start with that. You can travel with it around the upper back. Yeah. So sometimes, you know, we did the back, but it's nice to revise that on upper back. Good. You can do that around the shoulder blade. And then, when you change onto the neck, you create more pinching. Now, how many of you think that when I press down here is different than when I press down on the neck? Yeah.
Yes.
Doesn't look good, isn't it?
No.
Right. So when you come to the back, you can press down, but when you come to the neck, you're just more like pinching them side to side. You don't press down. So I will use more my finger tips to do that. So I pinch between the thumb and the rest of the, and I can do a little bit of, you know, finger. You want to come closer? Come closer, yeah? It would be hard.
Is it called pinching, or do you just call it that?
It doesn't matter how it's called, really.
No, it's not.
No, no. As long as you know what to do, really.
Okay.
You know, it's Petrissage. As long as you know it's Petrissage, then you can call it, you know, there is one technique, you know how it's called? This one? Pac-Man. Yes, remember Pac-Man kind of eating that? You haven't been in the computer when you're, yes. There was a game called Pac-Man.
I have
Yeah.
heard of that.
You have it, yes?
Back in the 80s.
Yes, yes, yeah. I think it's one of the first computer games. So Pac-Man, yeah? It doesn't matter. As long as you remember, it's like the food, yeah? As long as you remember someone's name, so that's what matters really, okay? So you do that, and I encourage you to look at this place where you're feeling the skull. So you're feeling the skull attached to the muscles, because it's a very sensitive place. A lot of headache can start from the neck and spread around here, yeah? So around here, both me and Lisa will go around and help you with kind of feeling it, and it's quite important, and you'll be familiar with this place. Okay, so we did so far the finger petrissage, right? And then you continue with here, and then you can come here, even kneel, and you can do finger petrissage with the base of your wrist. Now the question is, what's the other hands doing? You can either do it on both hands, or if you want, just do nice hold onto the head here. And again, the emphasis is you using your body. Good.
How hard are we meant to do that?
As hard as is comfortable for you for now.
Okay.
Yeah? But the idea again is to move the muscle. So if you just move the skin, is not enough. Yeah? Good. Now let's swap sides. And I'm going to do that on the opposite, on the same side. So again, use a lot of your body to do that. You can track it down. So imagine that a lot of people, the shoulder is upward, yes? Because of tension, stress. So you're trying to help it by stretching it downward. Yeah? Now stretch as much as is comfortable for them. You can ask them, how is the stretch? Can I go further?
And different sides will need different stretches.
Yeah?
Because some carry their bags on one side.
So I would say that probably we'll stop with that. There are plenty of other technique, but let's keep that kind of light. There are techniques that you can do with the knuckles after, but we'll leave it, okay? Light, simple. I just want you to finish this weekend with back, neck, and shoulder. And around the neck, it's mostly the time you can spend. You can do that here. So that it is not complicated does not mean that it's not effective. It can be very effective by just doing it over and over and slower. So example, I can really just do that technique, and only me and Lisa feel that I actually quite move a lot for her, because it's kind of needed and I don't need to rush over. But I do it kind of deep.
By applying the pressure on your fingers.
Yeah. You can do a little bit of side to side. So one pressure here, then on the other side. There, on the other side. And then again, effleurage. You can then do the effleurage of the whole back and bring it to an end. So once you learn Petrissage on the back, the neck is a little bit more complicated because it has less space. And you have to be more considerate, especially when it comes to the neck. Yeah? So be attentive, and who said that? That you need to really concentrate on. Yes, you do need to quite focus about what you're doing, and then the rest will come. Okay, shall we start then?
Can you just review them again?
Yeah.
Yes.
The